Hello, friends, and welcome to another episode of the Concussion Nerds podcast. Today, I am getting to introduce you to Cait Leavitt, who is another one of our speakers. So excited for the upcoming Concussion Nerds Virtual Summit. And Cait is speaking to the clinician track specifically. Cait, I'm so excited you're here. Welcome. Cait is a new friend. And I love this because the way we came in contact is such a beautiful example of community. Such a beautiful example of surrounding yourself with just extraordinary people who, when they meet someone that are like, you need to connect with this person, they help facilitate and make that happen. So Cait and I actually met because her cousin is in an entrepreneur community with me. And I don't know what you and Tess were talking about, Cait, but all of a sudden I get this email from Cait. Oh no, I think you followed me on Instagram.
Yeah.
And so she followed me on Instagram. And I reached out and just said, hey, welcome. If I can ever support you. Then we sent an email and we started collaborating, but all because Tess, who I know from our entrepreneur Epic community, somehow started chatting with you and is your cousin.
Tess and I we were traveling together and we were both working on our companies and on this whole entrepreneurship journey. And then so I was telling her how my focus is in concussions and she's like, oh my God, I know someone in concussions. And so that's how that was born.
I love it. It's this beautiful power of, I think, couple things, don't be afraid to share what you do, right? Talk about what you do. I think so many times, and this always comes, but as women in particular, we don't, we feel like we can't shout from the rooftops on what we do and who we are and the things we kick ass at. Great. And so share what you do, connect with amazing humans, because then the things like this happen. And so Cait and I jumped on a call to literally just there was no purpose to our call except to just connect. That was the whole thing. And you're going to hear more about Cait today. She's an epic human. And so I really want you to get to know her. And literally, as we're sitting there talking in general, I was like, you need to be part of this summit. So, Cait, you have a job, a career, a business that is, one doesn't really think of it. It's definitely a bit different. You don't fit in a little box. Can you share with people in this space of concussion what it is you do?
Yeah. So in short, I basically work with athletes to help them develop the psychological skills that they need to thrive. And so whether it's mainly returning to sport after a concussion, but it's also once they've returned to sport, how can they develop their confidence? So it's really all of the mental skills that one needs to excel in their sport.
Okay, there's so much of that I want us to dig into already in that one sentence. Side note, already, pause the podcast, jump to the link below, register for the summit if you haven't, because Cait's going to go deeper into this concept in the summit. We're going to give you a super high level today. But Cait, I'm really excited to talk about what you do, but I also know you come about this through the lens of someone who's had their own journey with concussion.
Yes.
Can you share a little bit about your journey with the audience?
Absolutely. So I now am 3.5 years out of a concussion and I am able to now describe it's one of the best and worst things that's ever happened to me. I've had many injuries. I've broken every bone in my leg. I've broken my wrist twice, all the things. Concussions are a whole other ballgame. I was in a car accident right before Christmas of 2020. I was hit on the side. So I got side whiplash and concussion, went to the hospital because they thought I broke my pelvis. And I was throwing up. I had ringing in my ears. I was incredibly anxious. It was also my second car accident and they happened in the exact same way. So it was quite triggering.
Yeah.
But I went and they just basically pumped me full of whatever that anxiety drug is and sent me home. And they were like, you're okay. I kept throwing up. The next day I was like, wow, my back's really bad. It was really emotional. But I was like, oh, it's my second car accident. I knew nothing about concussion.
Okay. So you were given no information.
Absolutely. And I was ringing in my ears, throwing up. Yeah. And I told them, I was like, my ears are so loud. And they're like, it's fine. You're anxious. Thank you. Yeah. Anyway, so a couple of days later, I was at work. I was working at a physio clinic while doing my master's in psych. And I was getting really disoriented. I walked to the back of the clinic and I'd be like, what am I looking for? It was really disoriented. And I called my sister and I started stuttering a lot. And she was like, you need to go to urgent care. You definitely have a concussion. And so I went to urgent care. They did the scat and I had a concussion. But because I had waited a week, I had done all the wrong things. It was Christmas time. So I was staying up late. I was looking at screen times. I had alcohol.
You were celebrating the Christmas season.
Exactly. And so 3.5 years out, I have had a headache basically every day since then. There's been a few times basically when traveling, I'm surrounded by beautiful nature that I don't have them, but on average, 2 migraines a week. I've done all of many people who have PCS or persistent concussion symptoms. Like I've tried literally every type of treatment possible. I've done physio.
I'm gonna I'm totally plugging here. Like Cait and I are chatting tomorrow about her coming to do an intensive
Was also like was like a beautiful outcome
of our
of our
conversation.
initial conversation because I had no idea that that was something that would benefit me. But yeah, so like everybody, I'd tried every treatment possible, and like some worked absolutely. But
Mm-hmm.
I'm now 3.5 years out, and I'm still having really debilitating symptoms. But one of like the pivotal moment for me, I was like, it's so funny looking back on it because I was like doing my master's in sports psych, and I was like, oh, I have to do a thesis at the end of this. Like, I need to do research, and I had so many different ideas of what I wanted to do. And my favorite sport and hobby is mountain biking. And
Okay.
obviously, like mountain biking, it's like very high risk. It's pretty challenging. So like not only did I have like autonomic dysfunction, so like I couldn't get my heart rate high enough to ride yet, but I had like significant cognitive impairment. So I remember the first time I rode, I just went down a really easy blue trail. And I remember seeing a corner and I was like on my bike and I was like, there's a corner, turn your bike, move your handlebars. And I just remember like staring at it and I just like basically went over the berm because I like
The
was
connection
very,
wasn't there.
yeah, the connection wasn't there, and I was like, very anxious. And anyways, I just like came home like bawling, being like, I'm never going to be able to bike again. Like this is my favorite, like not only like source of community and exercise, but like also is like huge part of my identity, like and all the things. And so that was when I was like, oh, I'm going to do my research on the psychological recovery of concussions.
Okay.
And so now that's like what I get to work with athletes on a daily basis is like helping them get back into their sport and also just their life with
Oh,
whether they still have symptoms or not. It's just like helping develop those psychological skills so that they can enjoy themselves again.
oh, thank you for sharing your story. The first part of your story, like you went because like to merge, like worried about a fractured pelvis, like worried about like if you can't see
Noticeable.
me and you're listening to this, air quoting right now, the more traumatic injury
Yeah.
of like the major fracture bones, internal bleeding, all those pieces, right? Like the pieces that could kill you. But then once those were ruled out, there was no further discussion on like what else could be happening. And so like thank you because like so I'm speaking at the World Orthopedic Conference in Spain in
Cool.
September. And this, like your story is why. Because the people at this conference are, I'm totally detracting here. It was just
It's
like
good.
again, I feel like our conversations come at a time when you're like, reminder, like, yes, everything just kind of falls into place. It's like, so I'm speaking to these conference goers are orthopedic surgeons and like big pieces in the ortho. And then there's going to be, I say like little old physio Natasha strolling in to talk about concussion at this orthopedic conference. But your story is exactly why I'm speaking to this audience because yes, they do amazing, but then they're missing a piece that can absolutely, excuse my language, fuck up someone's life for years after or turn it upside down because it wasn't caught. And so this is literally why your story, Cait, is like, and that like your example of sharing is 100% why I'm going to speak at this conference.
And so like I'm going to tag into this because like this
Yeah.
gets me on a rant. Some of the nurses that were with me while I was super anxious, like I had a nurse just sit with me and hold my hand and like realize that like, and which was like beautiful on so many levels. But then it's like when the main doctor came in and just basically dismissed everything I was going through and pumped me full of drugs, I was like, I was studying psychology. I'm like, I'm pretty aware of the impact that that can have on a patient's experience, but it was so invalidating. I was talking to my sister, who is a doctor, and she was like, to be honest, like, I didn't receive education on how to treat concussions, or I did. It was like a 3-hour workshop being like, today's topic is concussions, move on.
Yeah.
And then in all the physios I've worked with, like they've done additional training, like the stuff that you provide, but to be able to treat that population, but they're like, they had to seek out and pay for that. And I'm like, especially with the increased education around concussion, like they happen all the time. They're like way more common than we'd ever like to admit, yet they're not being taught in our medical system, at least in Canada and North America, which just like really highlights the systemic problems that are within our healthcare system.
Yeah.
Which also is like a huge driver of what I do. I'm like, I have easily spent upwards of 20 grand on trying to heal my symptoms. And so like when I work with athletes, like I can very easily spend 72 hours staring at my screen, researching concussions. Yes, it gives me skyrocketing headaches, but like I love it so much because I do not want to be another healthcare provider who they go to and they're like, oh, did that, didn't work. And so it's like, because I've been through what I'm working with athletes on, I like really try and blend real life experience and education and research so that it actually helps them, because so many treatment providers out there, whether like just are not educated on it. And it's really frustrating from a patient experience.
Well, and from even like from the physician standpoint, I truly don't care if they know how to treat a concussion. It's not what they're supposed to do. But they absolutely need to know how to identify and who to refer to.
Absolutely.
And like in that scenario, and like I know I hear that, and it's such a mixed bag of emergency departments right now. Of like sometimes they're given a handout of like da 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 da, and then sometimes they're told nothing, and it's still like it's just not consistent enough to make me happy.
And it's like, luckily, like because my sister is a doctor, she connected me with a doctor who specializes in concussions and could help guide my treatment, which I'm like beyond grateful for, because not only was it like, okay, she's telling me what I should focus on based on what's happening, but she was like, I understand that what you're going through is so challenging because there doesn't look like there's anything wrong with you. And like, which like, obviously like a lot of people know how it's like, we're called the miserable minority for a reason. Like it's an awful medical challenge to experience. But yeah, there's like some really good practitioners out there and some really bad ones. And even like if I was reading a study on like coaches' perceptions of concussions, and they're like, they're rare. Like, yeah, you can have dizziness, you can be knocked unconscious, you can have seizure, like all these things of like what to do to remove an athlete from play. But like none of them knew that there were psychological changes or challenges that athletes could experience. And like all the research shows that the psychological effects can prolong the symptoms. So
100%.
It's not even that it's miserable that your athletes are 2 to 9 times more likely to get depression from it, but it's like, it's not even known that's part of it. So it's like the athletic therapist can help them get treatment, but if they don't know that psych is part of it, how are they supposed to help them with that?
Well, and then you look at so many, especially if like if someone who's like a high level competitive athlete, whether we like it or not, it becomes part of their identity. And when that identity gets, and we can have this conversation about like anything in the concussion space, when that identity gets questioned and they lose that piece and it can't become their social outlet and it can't become anything they do, that's where that risk of depression comes significantly higher. And it needs to be like, you need to take it into play with everybody, but like it needs to be factored in for sure.
100%. And like a lot of the research shows that like if you have too strong of an athletic identity, which is like the majority of high performance athletes who haven't done any inner work, like a lot of them who have self-awareness and have done some psychological skills training are aware of the pros and cons. But if you have too strong of an athletic identity, like you're more likely to like overdo your exercises, which is going to give you a symptom flare up. And it's like all these things where it's like, you just can't ignore it, or you can try, but it's not going to work.
Yeah, no, absolutely. It's funny. So it's another huge piece. So for our local community, where we give back is the presentations with the sports clubs. And so we have one coming up with a local sports group, which again, it's for all the coaches, the managers, the safety people. I'm like, and then we should probably invite the parents. And so it's trying to, again, get that word out as much as possible because, but I love what you do because I can like, again, I talk about concussion requires a small village, right? It's not just one person that is like the person that helps you get through this at all. And I see it in the athletes that I treat, right? Like objectively, things are good. They are ready to go back. And the anxiety, the fear of being hit again, the confidence is not there. And I will not officially clear someone to return to play, even until their coach can tell me they see their confidence in the field. Because that lack of confidence.
Listen, I love that you do that.
Because that lack of confidence is going to put them at increased risk for injury again.
Exactly.
But no, that's okay. And so I won't do it, which is not normal. Like that, when you look at all the protocols, like that is not a standard, like that is not in the protocol whatsoever. But my job as a therapist is to help you get back to, this is what I say to my athletes, literally just had this conversation. I said, I love that you have the sport that you love to play. My job is to get you back to it as quickly as I can, safely.
Yes.
I said, so there is going to be, I say this in like day 2 and 3, there is going to be a period of time in this journey where you hate me, where you are cursing me under your breath, and you're going to decide whether to listen to me or ignore me. I said, and that period is going to come when you start to feel good, and I tell you can't go back yet. And then I explained why and like what I'm looking for and those pieces. And I said, but I need you to trust me. And so we literally just had this athlete last week that I said to him, I said to him, I'm like, remember when I told you that there was going to be this period of time where you didn't like me. And he's like, yeah. I'm like, we're in it right now.
It's now. Yeah.
This is right now. Because he sure as heck was getting frustrated.
Yeah.
But then that other piece is I need to see confidence. Because if we are lacking that confidence, your risk of injury. So my job is to return you to play safely. So if we're lacking that confidence on the field, or even in practice, if we can't even show confidence in practice, why on earth would I be clearing you to go back to competitive play? Because you're at an increased risk for injury for yourself.
And especially because like when you're back into competitive sport, it's like the pressure is there, whether you are incredibly resilient or not. There is pressure associated when you're playing a competitive sport. That is the nature of it. And that's what makes it fun. That's why people love it. But it's also like when you're in those pressure-filled environments, you are going to default to your habits or to whatever neural pathway is most prominent for you and how you cope with things. If you haven't done the work to build your confidence or stabilize your identity or do all these things, it's going to go back to whatever you normally do when you're in a pressure-filled situation. And so usually with the athletes that I've worked with, it's unhealthy coping mechanisms. It's like, they're like, oh, I'm back in. I have to go like balls to the walls and push myself as hard as I can. That is not going to, one, facilitate performance or your mental health. So I love that you work with your athletes on the confidence side, because honestly, it's such a missing piece. And it's like, it is one of the most confidence and managing anxiety are the two most common things I work with athletes on.
Okay.
But it's just so missed in the return to play process. Like even in the return to play protocol, like stages 4 and 5 say you have to be able to think and make decisions. And then stage 5 is you have to play with confidence. Okay, but who is talking about how to do those things? And so
let's talk about that for a second. So as a therapist who works with a person in clinic, right? Like I will go on the field, but what types of things can a therapist or a therapist like a physio or chiro, whoever it is that's working on the return to play in clinic, what kind of things can they say or ask a client to help determine, besides saying, do you feel confident going back to sport? Like besides that obvious question, like besides that one, what kind of discussions might they have with their athletes to know if this is something that needs greater support?
100%. So I think like the biggest thing, I just did a presentation to a bunch of physios and chiros who work in a sports clinic and exactly on how to identify return to play. And I would say like my biggest recommendation is like usually when you're dealing with an athlete with a concussion, you've seen them a bunch of times. So you've developed a relationship, hopefully it's safe, and you have that rapport. So it's like leveraging that and noticing if they're having different emotional changes. So like athletes are shown to be most emotional in the first 18 days after a concussion. And then again, it dips and then it skyrockets again right before return to play. So it's like, are you noticing any mood changes in them? Are they asking a bunch of questions about, oh, what can I do this exercise? Should I do this exercise? Like they become like over controlling. Hypervigilant is a way better word. Thank you. Or if they've become really withdrawn and are like, oh, I'm noticing pain here. And like their symptoms are sort of like, obviously a lot of concussion symptoms are unpredictable. Like that's what makes it so challenging.
But if they're coming out of the blue, not making sense and bouncing all over the place.
And like basically showing that they're trying to find a way to delay the return to play. Those are like 3 very obvious things. And so like, there's all these questionnaires that psychologists can use about assessing confidence return to play. And like one of the questions is like, how confident are you to return to play? Second one's like, how confident are you to give 100%? Third one's like, how confident are you to play pain-free? It's like any athlete who's super driven to get back into sports, like, yeah, I'm good. Or they'll go really low on the score. It's like, they're like, so I don't use those. Also, concussion patients are inundated with questionnaires. I don't like to use them personally. But so it's like, you can ask questions, be like, oh, what are you most excited about in sport? What have you spoken to your coach about? Are there any drills that you really miss? Like, and so just like sort of talking about the sport, and then you can gauge their emotional reactions to those type of questions, because it's sort of like a roundabout way of being like, where does your head sit with all of this? Mm-hmm. But it honestly, like it does, a lot of it comes back to like your relationship with the patient and like being able to identify what you think is a quote unquote normal response for them.
Well, and I think this speaks to, again, it comes back to like, I just love how like this, we keep coming back to like community and village here too, because with athletes, like you have to, like the best return to plays we have out of the works are the teams that we work with. And there's one team in particular, there's a junior B, or I guess they're junior A now. They were junior B when I worked with them last year. They're a junior B hockey team. And they're actually up island. Like it takes them an hour and a half to get to my clinic for rehab, but their coach sent everyone here because of the quality of care they got. But we had an amazing relationship with the athlete, because a lot of these boys at this age too, in hockey in BC, well, you're in BC, like they're billeted, right? So their families aren't here for many of them. And so, but like we had an amazing relationship with that coaching staff of that team, particularly the head coach. And so for us, it was the head coach, it was the athlete, and then looping the parents in wherever they lived in this country. And so obviously the boys are all under 18, but always got consent from the boys to talk with the coach to be like, hey, like, are you cool if we like loop your coach in and I can update your parents? And so that way you don't have to be the one regurgitating the information.
Yeah.
And they were always like, oh my God, yes, please. And so we'd like fill the parents in just so the parents understood what the heck was going on. But the head coach and I had an amazing relationship where I'd be like, here's what he's cleared for. This is what he's allowed to do. Please make sure he's doing this. And then first practice back and be like, how's the like conversation with both the coach and the player? How's he looking on the ice? And the coach would be like he's on fucking fire. Excuse my language. Like he's on fire. Or there were scenarios where we'd be like, he looks like he's holding back. So then that let us feed into the conversation with the athlete in the clinic to be like, tell me what's going on.
And it's so important to involve, like a lot of people know who work in concussions, like there's not one thing that's going to solve more things. It's like you said, like it really does take a village. And it's amazing that you had that positive experience with that coach and were able to work together, because that is what makes the difference. Like it's
the
having
best outcome
that communicates to each other to be able to help someone thrive, so that the physio knows that, oh, he's holding back, being like, okay, that's an indication, or he's giving it way too much. Like, cool, that's probably going to cause muscle tension and all these things. Like there's so many intricate little details that working together really is what can make or break your rehab.
Well, and it's like that conversation of like, he's holding back. And it's like, so then I can say to the coach too, like, give me a specific example to then talk to the place. And to then also, if it's something that we haven't dipped into here yet, is there something that I can recreate in clinic that's similar to the demand that's required to show success? In rehab, we need to be able to show our clients success to start to build that confidence. And so I've totally been in those scenarios where like that relationship with that team in particular is the best relationship I've ever had with a coach, because I've had the opposite where like the coach won't talk to me.
Oh, I've been there.
Which is so much harder.
It is so much harder, but that's just like when you really hone in on the athlete relationship.
Yeah.
This is like a perfect example of like how like my work sort of ties into it. Is like, yeah, I've worked with many athletes with concussions. Thankfully, only a couple that had like really severe PCS. But it's like, if I do like goal setting is a very common technique that we use to help with motivation. It helps with confidence. It helps with your identity. It's a fantastic thing. It's usually done not correctly. So I have a very simple process that I walk athletes through. And then if one of their things is like they want to like reduce their neck pain or whatever, like obviously we get more specific than that, but it's like I will work with their physio being like, hey, this was one of her goals. I get consent, of course, from the athlete being like, this is what she's working towards mentally. Like, can you incorporate that into her rehab plan? Or it goes the reverse, being like, my physio said to do this. How do we build a goal around that? But if we didn't work together, just everything falls on deaf ears or whatever that saying is.
Yeah. I want to backtrack a little bit because you mentioned it, you put a term together that I've never heard before. And I want to understand a bit more about what you mean. So you made this mention of like, if your identity isn't stabilized, what do you mean by that?
So I'll like bring it back to my experience. Was never a professional athlete, always wish I was, but my identity was always wrapped up in playing sports. Like that's what I was known for. That's what I loved doing. That's what all of my hobbies were. If your identity is, it's like putting all of your eggs in one basket. If you base all of your experiences through the filter of being a hockey player or being a rugby player or doing all these things, if that's taken away from you, it is ridiculously destabilizing. Because not only is that how you tip, like it gets pretty deep, but like that's how you gain your sense of self-worth. And if you don't have other sources of that, you really feel like you're hung out to dry. And so a lot of the work that I'll do with athletes is like, okay, what other interests do you have? And there's a lot of pushback in athletes being like, if I don't go 150% in as this is my life, then I'm not going to be able to get to the top of the top. And it's like, that's actually not accurate. If you have, obviously it can be a large portion of your identity, but you need to have those other aspects of yourself so that when that's taken away, you don't fall into a deep depression. Mm-hmm. And that's why the rate of depression is so high among athletes who get concussions, is because their number one source of how they view themselves and how they think others view them is taken away from them. So it's like another way of like, it's saying like a more balanced identity. And it's not to say that sport can't be the majority of it, but it can't be the only aspect of it. And this is like a long-term thing. Like, it's not like I'm going to have a 30-minute session with an athlete on identity and call it a day. Like, it is like,
you're gonna wrap it up in a bow and it's finished.
I wish, like, I don't wish. I actually love the conversations around identity because it goes into values and like some of the more deep psychological concepts, but it's an ongoing bit by bit process, but it helps their performance in the long run, which is what they want.
Yeah. Okay. We're going to talk after this podcast. My brain right now, Cait, is like, you're just starting to get to know me, but like I have fireworks going off in my brain right now. And I want to talk to you about a couple things after this. Like literally, I'm like, hold on, I need to formulate a sentence because I have like spinning hamsters running in like 5 different directions in my brain right now. This topic gets me so excited. What is the process of working with you? Like, what does that look like?
Yeah. So like my niche, doing air quotes, is like working with injured athletes. So it's like a lot of ACLs, meniscus, broken bones. But then I also obviously work with concussions. And it's the same process, which I will get into. But obviously I adapt the concussion patients to be more flexible, essentially. So typically the number one question athletes always want to know is how many sessions until I feel better.
Yeah.
And I'm like, cool, how long is a piece of string? Like, there's no way.
That is the best answer I think I have ever heard in my life.
Like, you have to be realistic at the get-go. I'm like, well, if you're committed to doing 5 to 10 minutes of mental work every day, cool, you're probably going to see results pretty quickly. It's all about the consistent, boring actions. There's nothing sexy about it. There's nothing with a gold bow. And that's what people really get stuck with, is like, they want that brain hack or this quick fix. That doesn't work. Sorry, folks. So if that's what they're looking for, I'm not the right practitioner for you. But typically it's like, I'll do an intake session, which is like a 45-minute chat of like just getting to know you, being like, what do you like? What do you not like? What are your experiences? And then through that, we sort of formulate with the athlete a mental skills training plan. So it's like, what are their goals? I'm not going to tell them what they should work on. Like, autonomy is a huge thing, which can be stripped away from athletes with concussions. So I really incorporate them in what we're going to work on. And then usually it's like once a week or once every 2 weeks, depending on their symptom threshold, really, we'll do a 30-minute chat. But this is what I mean by how I work with a patient with an ACL tear or surgery is different than a concussion, because like some of my patients can't look at a screen for 30 minutes. So it's like, cool, do you want to do a phone call instead? And it's just like, why adapt the content to meet them where they're at and within their threshold. But I like to find fun ways to provide education on psychological concepts, because it's like, I love neuroscience, I love psychology, not everybody else does. And so it's like, okay, I try and give an example of, so let me talk about like, so for example, emotional regulation, anger, frustration, guilt, all these things happen when they first get injured or first get concussed. But I'm like, if you don't create space to actually sit with those feelings, they're going to come out in a few days or in a few weeks and they're going to explode. And it's like, my way of explaining that, it's like, okay, imagine you have a beach ball, you're in a pool and you push the ball underwater. What happens when you let it go? Well, it flies up. Okay, cool. The further down you go, the more it pops up. So it's the exact same thing. The more we suppress our emotions, the louder and more aggressively usually they're going to come out. So it's like, I always like to explain things in a way that will simply help them understand what's going on for them. And then it's like a conversation. Like, it's not, I always have some activities planned of what we could do based on previous conversations or where they're at in their stage of return to play. But it's not like, oh, session 1, we do confidence. Session 2, we do motivation, because that doesn't work. That doesn't even work for patients with ACLs. Like, we're all unique individuals. And I've gone through prescribed treatment plans like that. And I'm like, it didn't meet me where I was at. So all of it basically was a lost cause. So it's really flexible. I always bring in some educations. I always get their opinion on what they want to do. And it's finding ways to intertwine the psychological skills that fit their daily life. Because like, my big thing about my approach is it all comes down to the consistent, usually boring actions that will make a larger impact down the path for them.
But I love that you say that. You're like, this isn't exciting. It's not fancy. It's not going to have all these gadgets, but
like, it can be fun. We can make it funny. I always use humor with my athletes, because a lot of the times I find mental work to be way too serious. I fell into that trap myself. It just takes all the fun out of all of life. But yeah, some of the activities are actually really fun, but like doing them on a daily basis, like the only way of saying it's not sexy, but it's really effective.
Yeah.
It's like
I love it.
there's an amazing book that I love. It's called The Slight Edge by, oh God, what's his last name? Jeff something. And it
I'm writing that
basically,
down.
I love that book. It basically talks about how the things that are going to make or break your success, like I'm using quotes because it's like whatever success looks like to you,
Yeah,
are
absolutely.
usually the things that are really easy to not do. It's really easy to skip journaling in the morning. It's really easy to skip a workout. It's not like you're going to die. It's like, it's very easy to not do,
Mm-hmm.
but it's like deciding to do it, even if it's 15 minutes on a spin bike every day, is going to help you build that identity of like, I'm someone who exercises. And once you have that identity, you're way more likely to do it. It's like similar to the principles in Atomic Habits.
Yeah.
And so like, that's just like the basis of my work is like, I'd rather you do something consistently than think that there's going to be some shiny toy that will cure you.
And it's looking at those, like, I love this. I love your approach. I love like the way you think about it. Because like when you think about too, these people want to make life changes and they want to do all these things and they think they have to make these big radical things. It's like, no, let's start with our pillars. And for me, like the pillars are like the habits, the foundation, the like nutrition. Like let's start with the fundamental pillars.
Okay, so I literally like that is like one of like I have a big playbook that athletes get when they work with me so that like they can walk through information if they want to. Because a lot of them are like, oh, can you send me a podcast on this or whatever? But I'm so glad you brought this up because one thing is so many people overlook the impact of sleep, the impact of nutrition, and the impact of community when it comes to anything in life.
Mm-hmm.
So I'm like, I can teach
just
you
happiness, period.
Yeah. And I'm like, I can teach you all the things you want about emotional regulation. If you're not getting quality sleep, your brain doesn't even have the ability to leverage those skills in a deprived state. So it's, again, falling on deaf ears. So I'm like, and I'm not saying no other mental performance consultant does this, but I'm like, cool. How's your sleep? And if they're like poor, I'm like, cool. If that's what we're working on until that's stabilized, like I'm not doing anything for you by teaching you these skills until your brain is in a state to actually be able to use them. And any of the people I worked with, like as a patient, nutrition was never discussed, sleep was never discussed, community was never discussed. And I'm like, first of all, we're social beings. Like as much as our society promotes individualism and individual resiliency, we are social beings. That is how we survived. We cannot overwrite that. Yeah. So it's like, I really bring that in to whenever I'm working with an athlete. You're like, who do you have to lead?
I love it. Oh my God. Yes. We've scratched the surface of, oh my gosh. I feel like I'm just going to have you come back so we can go deeper in this podcast, honestly. We're going to do a part 2 episode at some point in the future, but we'll do a part 3 for the pod because part 2 is going to be Cait's presentation for the clinicians in the summit. So please jump down, snag it. That goal setting process she's going to talk about, my friends, that's her bonus for the summit. So jump in on the VIP option.
And I'm just going to plug in there. I promise you it's not SMART goals. I will never tell her to use SMART goals. I can't.
That was probably a good preface, actually. That's great. That was fantastic. Oh my gosh. Cait, this has been a joy.
It's so fun.
I am literally so excited for your presentation. How do people find you? Like, if they know an athlete, if they are like, how does someone reach out to you?
Yeah. So my website that was just launched is mindwithmatter.ca.
Oh,
yeah. So just a brief explanation on that. So like a lot of athletes are like, oh, push through pain, mind over matter. My entire approach is like, you need to work with your body within the context of your situation to actually thrive, whether that's your mental health or your mental health.
I love it.
Yeah. So mindwithmatter.ca is the best place to reach me. You can either like book a discovery call if you want to chat, or you can shoot me an email.
Okay, sweet. Oh my gosh. Thank you.
Thank you. And thank you for creating this community of people who want to change the landscape of concussions. As a patient and a practitioner, it's like so exciting.
Thank you. It is. I always say like, it's one of those things like this world is going to change from the ground up, and it's going to be those of us that are on the front lines repeatedly putting ourselves out there and having the conversations and creating the opportunities and not being afraid to do something different. That I always say, you know, as a clinician, you can either choose to be someone who runs with the pack and practice. If you're a clinician listening to this, please don't take offense, but it's like you can be someone who only practices evidence-based peer-reviewed studies, and that's all you do. If the evidence doesn't have 20 peer-reviewed studies behind it, you don't practice it. Totally cool. You're running with every other clinic.
Yeah. And
if you want to be someone that leads in this space, you have to be willing to look at things differently. You have to be willing to think differently. You have to be willing to take a safe risk and be willing to try something that isn't standardized yet, because we know it takes 10 years for the research to actually make it to mainstream.
And like, also, I totally agree with you. And it's like, also like, it's going to take trying to do something. Like, you can't keep doing the same thing over and over again and expecting different results. I worked with a team once, and somebody, a colleague of mine, I was getting a lot of pushback from coaches on even really the need for mental health and mental performance support for the female athletes. It was really challenging for me on a personal and professional level. And my colleague came up to me and he's like, Cait, I might butcher this quote, but he's like, lions don't concern themselves with the opinions of lambs. And that has like been so foundational for me, being like,
wow, that's a goosebump quote.
Yeah, I know. I think about it all the time because like, I do things differently, but I've lived through concussion recovery. Like, I have the lived experience. I have the scientific background of what works and what doesn't.
Yeah.
And so I'm like, I am very passionate about helping other athletes benefit from the work that I've done so that they don't have to go through the grind that I did.
Oh my gosh. You started this episode off by saying the concussion was both the worst and best thing that ever happened to you. How was it the best thing that happened to you?
I now get to do, every day I get to do work that I literally love. I am obsessed with my job, and I am very grateful because I know a lot of people don't have the passion. And
you think without your concussion and that mountain bike experience, you wouldn't have gotten here?
No, I literally knew nothing about concussions. I knew a lot about injuries and broken bones, but it's a different ballgame. So although it's like for sure the most mentally and physically and all domains of my life challenging thing I've ever done, it also led me to a career that is like so deeply fulfilling to me. And I'm incredibly grateful for that.
And we're going to wrap right there because that is just like beautiful. Thank you for being here. Thank you for all you do. To those listening, again, like, I'm just sitting here in awe of Cait right now, to be honest. Jump down to the link below. Come join us on the summit. It's going to be an amazing experience. There will be more of Cait. We're going to have you back. And until next week, my friends, we will see you then. That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.